Medical conditions. There are a lot of them. There's four in particular we deal with in first aid. Asthma, seizures, diabetes, and anaphylaxis. Let's go through all of these. Asthma. Asthma is a breathing concern. The throat, the airway fills with thick mucus. The person has difficulty breathing. This is a chronic condition. Usually it shows up in childhood, and then you have it for your life. It can get better, it can get worse, whatever. With asthma, the person probably has an inhaler. It's a corticosteroid that they inhale to help widen the airway and stop the mucus production. The first aid for asthma is get them their inhaler, basically. You can do the semi-sitting position for shock if needed. In general, you're dealing with breathing problems, you're getting them their inhaler. They know how to use their inhaler. If you don't know how to use an inhaler and you have to walk somebody through how to do it, frankly, the doctor should be teaching you. But if not, fair enough. If for whatever reason you're coming across an asthmatic and there's no one that knows how to use an inhaler that can help them and you have to do it, the way this would be done would be the inhaler would be shaken, put up against their mouth. They would press the inhaler, breathe in, and then hold it so it can absorb into their lungs, get into their lungs. They don't just go and no, they have to hold it in. If they have a spacing device, this is a large tube that goes on the inhaler, you put it on, shake the whole system, squeeze, and then they just breathe in and out with the spacer on. Spacers are generally better. If you have asthma or if you have a child with asthma and you only have an inhaler, please look into getting a spacer or the benefits of a spacer, because you might find that it's easier in the event that you have an asthma attack. What triggers for asthma, just so you know what can cause them, there's three in general. The first is temperature change. So if the temperature gets too hot or too cold, air gets too thin or too dense respectively, the density of the air can aggravate the asthma. That's one. The second would be irritants in the air, dust, pollen, etc. Stuff in the air that gets stuck in there and stimulates mucus production. The third would be exertion. So a lot of exercise or moving around a lot, physical exertion can cause asthma to flare up. So if you want to remember all three, think about running through a field of flowers with pollen on a hot summer day. That's like all three put together into one. Okay, that's asthma. Second, I think I said seizures. So seizures. Seizures are a hazard problem. What you want to do with seizures is protect the person from injury. There's the tonic phase and the clonic phase and all this. You don't need to really know this in first aid. What you need to know is that if the person starts, but if they start seizing, it could be just they stop, it could be they start violently moving, you need to protect them from injury. What's happening with a seizure is electrical stuff is happening in the body and the muscles are moving involuntarily, and they could be moving with more force than you could consciously do. So if someone did a perfect punch for some reason in a seizure, they could punch with more force than they could ever consciously punch. You're talking about maximum force is possible with a seizure. If someone's doing that high force into a wall or into something, they could damage it, they could damage themselves. If you try to block somebody with a seizure, they could hurt you. If you were to completely tie somebody's arm down that was seizing, they could dislocate their own bones. They could potentially break bones if they have osteoporosis, brittle bone disease. You want to let someone who has a seizure, let them flail, but make it so they don't flail into stuff. Ideally, if you had a giant like cushion, if you had like a pillow fort, that would kind of be like ideal for a seizure. So you just like bash into cushions all the time. If someone has a seizure at a table, this is fairly common because they're sitting down, they go into a seizure, fine. They're around a bunch of hard chair, table, whatever. There's a lot of hazards around. So once again, seizures are a hazard challenge, okay? Get them away from the hazard. That's what you're doing. Do not restrict them. Do not put something in their mouth. Do not hold their tongue. There has been first aid courses that have said that in the past. Let them do what they do. Do not put a towel in their mouth. They might just bite through it and choke on it. Just let them seize. Now, if there is their first seizure, if this is their first seizure, hospital. If they have a seizure for more than 3 to 5 minutes, now we're worried about not breathing for an extended period and brain damage, hospital. If they go into multiple seizures back to back, hospital. If this is a person that has a seizure via medication once every second Wednesday at 3 o'clock for 1 minute, and it's regular, this is probably not a hospital situation. This is probably Wednesday at 3 o'clock. Okay? There are cases where this is not actually a hospital situation. If you don't know that, though, err on the side of hospital. When someone seizes, because they're moving with maximum force, this takes a lot of energy. Imagine sprinting, right? We're sprinting. Imagine doing that with your whole body. So you're not just sprinting with your legs, but you're sprinting with your arms at the same time. Everything's moving at maximum force. Imagine doing that for like 90 seconds. How tired are you? They want to have a nap. Okay, they're exhausted very often after a seizure. There must have been tensing and contracting. They've just been burning through energy. It's completely physically exhausting. So very often someone who has a seizure will want to be put into recovery position or basically napping, and then want to basically just relax. They might not be unconscious. They might basically faint or pass out due to physical exhaustion. You're not as worried about them going unresponsive necessarily. They could, if it's a longer seizure, they could be on unresponsiveness as well. You have to check. So you're still doing your check every 2 minutes to see if they're breathing thing, just in case, but virtually all seizures, keep in mind, this is physically exhausting. Them wanting to have a nap is probably a part of this for you, okay? That's basically seizures. Anaphylaxis, severe allergic reaction. There are different types of allergies. There are allergies where you have a mild reaction. A lot of cat allergies are like this, for example. You can get all stuffed up, clogged up. It can feel very uncomfortable, but your skin isn't breaking out in hives. Your throat isn't closing. You're not going into a life-threatening medical emergency where you simply cannot breathe. The anaphylactic reaction, the life-threatening one, where everything's closing up, like you just can't, you have a serious problem, that is the one that we're more concerned about in first aid. Now, anaphylactic reactions, generally speaking, get worse every time you have them, and you don't, look, if the last anaphylactic reaction you had resulted in you having to inject multiple auto-injectors and you barely lived, and it was 10 years ago, don't risk it and don't do it again. You might not live, okay? Like, they generally speaking, from what I've heard from multiple allergists and from what I understand in the medical industry, they generally speaking are the same or worse generally than the last one that occurred. So do not test if you are still allergic to peanut butter. You are probably still allergic to peanut butter. Why am I going into this whole tirade about this? Because technically, you can gain or lose anaphylactic allergies with significant hormone changes. This is something that we've noticed. So puberty, after puberty, you could have been tested with an allergist with a blood test or with a prick test prior and found you had certain allergies. Post-puberty, you might have lost certain ones or gained certain ones. This is why it's often recommended to go to an allergist after there's been a massive change in hormones. Puberty is an example of this. Pregnancy, some women will have new allergies show up just for the duration of the pregnancy. And then when the pregnancy is over, the allergies go away. There is some research on allergies existing from what I most recently saw. I have to check this again. But from what I understand, there is some risk of allergies coming about with hormone treatments for, well, any number of things. There'd be gender-affirming therapies, which have hormones components that could affect allergies, which would happen for the duration of when you're on the medication. There's some indication that that could be a thing. We're talking about huge amounts of hormones, so you generally wouldn't see it, from what I understand, from like birth control pills being used. But we're talking about massive amounts of hormones. So anytime you're dealing with a huge shift in hormones, look, if you have a healthcare system where you can ask a doctor, hey, should I be concerned about should I talk to an allergist and see if I have anything else when I'm going under this? Sure. If the doctor says it's no problem, it's no problem. Fair enough. Right? But it's one of those better safe than sorry. You don't want to be, oops, I'm allergic to peanut butter. you don't want that. So yeah, so just keep in mind with allergies, don't mess around with anaphylactic ones, and sometimes you can just gain new ones. So when in doubt, I wasn't allergic to shellfish when I was a kid. What gives? Well, you haven't had shrimp for 20 years, and turns out you were. You are now, right? It just happens. Okay, so what do you do for an anaphylactic reaction? This is immediate. This is start first aid right away. Person, it could be in a full-blown hive, so bumps on the skin, throat closing. There's probably a look of absolute panic and terror or doom in the person's face. You see panic attacks often associated with anaphylaxis because the person thinks they're about to die because they may be about to die. You're going to get a lot of emotional feedback, a lot of visual sort of feedback from the casualty that way. They may be reaching for a bag. The reason why they may be reaching for a bag is because they might be looking for an auto-injector. This is a trainer for an EpiPen. That's a brand name of a type of auto-injector. You don't have to get EpiPens, but this is just the most common one in our area. And to be honest, we ask them for, trainers, the ones to train our instructors to train with, and they just send us them for free. So like, I have EpiPen trainers. So let's be honest here. So EpiPen trainers, this is the common one. They've done big media pushes, so you'll see it a lot. We'll give you other angles for it so you can see. We've got an orange end and a blue end, right? So we've got an orange end and a blue end. And the way this works is ideally you want to have the blue part out and the orange part go in. This is where the needle is, the orange part. The old adage is blue to the sky, orange to the thigh. So when you want to look at this here, so we have a thigh, we have the EpiPen. Yeah, I think this angle is a bit better. So we have the thigh, we have the EpiPen or the auto-injector. You want to take the cap off, the blue part off. That makes it so this can go out. If this isn't off, this won't plunge. And then make sure that there's no phone or anything at their thigh where you're going to put this in. We're talking about the upper outside of the thigh, the meaty part. No phone, nothing in, and this will go right through jeans. So as long as there isn't like a solid object in the pocket, like coins or whatever, this will go right through. So you're going to go right over and hold it for 5-10 seconds, whatever it says in the package. Right? And it comes out. And what will happen, and you can see this here, is this will cover the needle that has extended. So you don't have to worry about this sticking other people around. EpiPens, auto-injectors, are a protected medication. However, so this is a medication that you are administering. This would normally be considered a medically controlled act. And depending on what country you're in, it might still be a medically controlled act. So keep that in mind. On them, though, if it is something that someone in the public can use, you will have, let's see if we can get text there. Yeah, we can. You'll have instructions telling you what to do on it, steps of what to do, just in case you forget. So you'll have instructions on the actual medication. In Canada, we had a case. It'll kind of explain why you're allowed to use a medically controlled something like this. Because this is a controlled medical act, no question. You're administering a medication. You're administering adrenaline directly to the bloodstream, like you're puncturing the skin with a needle, right?
Hello, Editing John here. We aren't able to get into too much detail onto the Sabrina's Law case. If you are interested in learning more, we'll have some links in the description for you to check it out. Otherwise, enjoy the rest of the video. Thank you.
A new law was made which was named Sabrina's Law. It's a law that basically creates a structure so that interim guardians like teachers and schools, etc., have a process wherein if your kid or whoever has a medical condition, they can get trained in how to use the medication, they can get access to the medication, the school can store EpiPens, etc., and the teacher doesn't have to be worried about touching a student. Teachers aren't supposed to be generally touching students and administering medications, right? That's a lot of parents go, oh, whoa, right? that's not cool. So this was one of those weird, but you kind of want them to do it in this case. So Sabrina's Law, if you're interested in Canadian law around this stuff, if you Google, auto-injector, EpiPen, anaphylaxis, allergic reaction, Sabrina's Law, stuff will come up on this. It's really interesting stuff. And actually, there's been some discussion around using Sabrina's Law as sort of a blueprint for creating health and safety policy for other medications. So if you have someone in your workplace, so not even in a school, but if you're in a workplace and someone has a specific condition where they would want a designated first aider on site or someone to help out with that medication, Sabrina's Law creates a sort of kind of blueprint where you could work with that person's doctor and possibly get a medical exemption or sort of get medical approval to administer something in that environment. So this is, the doctor allowing you to do so via the doctor authorizing it. It's something very specific, but it creates sort of that blueprint so you can have that conversation. So you don't have to worry about, well, I mean, I want to save their life, but this is outside of normal first aid and I don't want to get sued, and the incident claim, the claims, and the workplace safety insurance, and the what about. So this creates something for you to kind of work with there. So it's really nice. It's really good that we have that now. Unfortunately, the tragedy had to occur for us to figure this one out, but now we do have that. So you can, in certain jurisdictions, it's standardized. You got the EpiPen, read the thing, do it, right? You can just do it. But check if that's the sort of thing that's okay in your area or not. I don't want to get anybody into trouble. Okay, so we have that. And then we have diabetes. Now, diabetes is one of those things where there is a medication, and in this area, you are not administering that. This is something that they can administer on themselves. This is something that is a controlled thing for them. This thing I'm talking about right now is insulin. Insulin is something they have to dose based on their blood glucose. It is far more complex to do than an auto injector in terms of understanding what's going on. It's not an old joke. It's not rocket surgery, but it's more complex than an auto injector. So if the diabetic who's having a diabetic emergency, is going into diabetic shock, says they need their bag, they need their insulin, and you can hand them their bag, that's one thing. Fine. Other than that, we can talk about how to identify if someone's going into diabetic shock and then what to do about it within the scope of first aid. Someone going into diabetic shock is going to generally have shock symptoms, right? So they'll have your standard pale or ashen gray skin. As it gets worse, they can be cold and clammy. They will often shake. So it can be similar to hypothermia in a lot of ways. You can have that jerkiness. Sometimes they can seem confused. Once again, similar to hypothermia. They can say strange things. It's not to the same degree generally, but it can be similar. They may have an odor to the breath that is different. So if their blood sugar is low, otherwise known as hypoglycemia, they can smell like fruit. If their blood sugar is high, otherwise known as hyperglycemia, hyper, they can smell like nail polish remover or acetone. Urination and digestion stuff gets really interesting. So they can seem really or feel really dehydrated. They'll be really, really thirsty frequently, very often. They can need to go to the bathroom. They'll be urinating very often. This is the sort of thing that happens when their blood glucose and their insulin isn't really well regulated. So what do you do? Okay, this person is, going into shock. They might be shaking a bit. They might be a bit confused. They're, going to the bathroom all the time, etc. This is happening. The person might be conscious and saying, I'm diabetic, and they realize they're having that challenge. What do you do? Okay, if that happens, you should give the person sugar. So low blood sugar, give them sugar. High blood sugar, give them sugar. Doesn't matter. If they have a low blood sugar problem, the body will absorb the sugar quickly and it will start resolving the issue. If they have a high blood sugar problem, the body won't absorb it as quickly. It won't make the problem worse fast enough where, look, if someone's going into diabetic shock, especially in the public, you're calling an ambulance anyways. When the paramedics get there, even if you've given them a bunch of sugar, they'll just blast them with insulin. So you either help or you don't make the problem really any worse. It's just give them sugar, okay? Now, look, we're talking about carbohydrate. We're talking about glucose. It has to have sugar in it. Diet, insert drink. Insert drink 0 does not have sugar. It doesn't have carbohydrate. It doesn't have glucose. Also, generally, you're looking for a fast reacting sugar. So a simple carbohydrate like powdered sugar, fruit juice, pop, soda, soft drinks, not bread and rice. Okay, you're looking for things that give sugar quickly. Also, in general, it's probably better that you don't give some stuff that's very tough or hard to eat, because if they're going into shock and they're going in and out of consciousness potentially, like if this person is about to go unconscious and you give them something hard to eat, now they're choking on it, right? If they start losing it and you give them apple juice, that's one thing. You start giving them, dense chocolate cake. I get it, we like cake, but come on, we're choking on it now. Okay, so that's the general idea. Some people recommend candies. Some diabetics will carry around like a caramel candy or like a toffee. Fair enough, right? Like if that's what you want to suck on a toffee, you want to chew on that, fine. I'm not going to say, don't use any food ever. Look, it's just if you have liquid, it's better. But if you have nothing else and they want to use something that they always have for that, great. They do their thing. Sugar is sugar. Have at her. Just once again, remember, diet stuff doesn't have sugar in it. That's why it helps you, keep to your diet. Makes you ready for the beach. So, okay. Yeah. Cameraman John is losing himself over that. He's like, oh my God, that was cringy. I'm like, I know. Okay. Anyways, that's medical conditions basically in a nutshell.